Joint pain is commonly felt in knees, hands, feet, hips, or spine. At the end of bones, a firm, slippery tissue called cartilage enables nearly frictionless joint motion. As you age, the cartilage layer gradually deteriorates. And if the cartilage wears down completely, the bone will rub on the bone. Besides the breakdown of cartilage, joint pain or arthritis also causes changes in the bone and deterioration of the connective tissues that hold the joint together and attach the muscle to bones. It also causes inflammation of the joint's lining. Pain may be constant or it can come and go, and sometimes the joints can feel stiff, achy, or sore. In addition, the joint may feel stiff in the morning but loosen up with movement and activity. Joint pain is so common that 1 in every 4 adults has arthritis or joint pain. Fortunately, some natural vitamins help relieve joint pain and repair joint tissues. In this video, we will use the word vitamin broadly to include vitamins, natural remedies, minerals, and enzymes. Number 1. Chondroitin. Chondroitin is a building block of cartilage and keeps cartilage healthy by absorbing fluid into the connective tissue. It also blocks the enzymes that causes the breakdown of cartilage. Chondroitin sulfate supplement slows the progression of osteoarthritis and reduces joint swelling and stiffness. The daily recommended dose is 400 mg thrice orally. Number 2. Glucosamine. Like chondroitin, glucosamine is a natural chemical compound in our body, and it helps to keep up the health of cartilage. As you get older, the level of this compound begins to drop and leads to the gradual breakdown of the joint. Glucosamine sulfate supplements help to counteract these effects. People with rheumatoid arthritis, chronic back pain, and sports injury also use glucosamine sulfate supplements. The typical dose for arthritis patients is 1500 mg per day. Number 3. Vitamin D. Vitamin D, also known as sunshine vitamin, is produced by the body in response to skin being exposed to sunlight. It improves the body's calcium absorption, and this maintains bone health. It is an essential vitamin for preventing bone thinning, especially in people with a high risk of inflammatory arthritis or osteoporosis. It has an anti-inflammatory role and keeps the immune system healthy, making vitamin D an essential nutrient for different types of arthritis. The daily recommended dose of vitamin D is 10 micrograms per day. Number 4. Vitamin C. Vitamin C protects against the development and progression of rheumatoid arthritis and osteoarthritis for various reasons. Firstly, vitamin C acts as a cofactor in collagen synthesis. Collagen is the most abundant protein in your body and is present in your muscle connective tissues, tendons, and ligaments. You can say that collagen helps in holding your body together. Secondly, vitamin C helps fight against infection and control the inflammation caused by infection, which can trigger arthritis flares. Natural sources of vitamin C are citrus fruits, bell pepper, raw leafy green vegetables, and white potatoes. Number 5. Turmeric. The main ingredient in turmeric is curcumin, which has powerful anti-inflammatory properties. Turmeric helps to lower joint pain by reducing the inflammation of the connective tissues of the joints. You can use turmeric for joint pain whether you're suffering from osteoarthritis, rheumatoid arthritis, or any other type of joint condition. The daily recommended dose is up to 2000 mg of turmeric per day. Number 6. Fish oil. Fish or cod liver oil is rich in omega-3 essential fatty acids, vitamin A, and vitamin D. Omega-3 helps form the prostaglandin hormone, which regulates your immune system and fights joint inflammation. According to studies, fish oil can improve the symptoms of rheumatoid arthritis. You can take 1 to 2 teaspoons of fish oil daily for healthy joints. Natural sources of omega-3 include salmon, sardines, mackerel, and shellfish. Number 7. SAM or S-adenosyl-methionine. SAM is a chemical compound made naturally in the body by the liver. It stimulates the production of cartilage parts and has antidepressant and pain-killing properties. Other functions include helping the production and repair of cartilage. The SAM supplement helps the symptoms of joint pain caused by osteoarthritis. SAM is usually taken in doses of 200 milligrams thrice a day. Remember, this video is for educational purpose only. We are not giving you medical advice, so you should always consult your doctor if you need any professional opinion. Did you find this video helpful? If yes, then make sure to like this video, subscribe to our channel, and hit the bell notification button. Until next time, take care.